Hello, nurses. So I'm back again with some revision questions. And I understand you are almost the semester is almost over, and now we are in this pilika revise. So I was going through some midwifery revision questions, and I thought, why not share with you? So here's some questions and the answers that I got. Okay, so the first question is about obstructed labor. So the question is asking four signs of obstructed labor and describe nursing care with women with obstructed labor. So if you've read of you know from the actually from the term obstructed labor, what is it? This is the arresting of the where we have like good uterine contractions, but the labor is not progressing. This might be due to issues of presentation or malpositions or even a macrosomic baby. Okay, so what are the signs and what will you, as a nurse, what signs indicate that this is obstructed labor? First is um the first is you see if you do abdominal examination, this is what we call the retraction ring, where the fetus rises up and the lower uterine segment or the lower part below the umbilicus is small, and you see there's like a formation of a ring there. It's called a retraction ring or pathological banded spinal ring, yeah. Then also when doing abdominal examination, the second point is going to be fetal heart rate may be absent, indicating fetal distress. Then we have the physical examination. The mother, there's what we call maternal distress. The mother is exhausted. And she might also have ketoacidosis. Then we have also she might have tachycardia. Then scanty urine. Yeah. Then which is the other sign that you can find in obstructed labor? Oh yeah, if you do vaginal examination, okay, the first thing is that the vulva is edematous and swollen, and then when you do further inspection, when you reach the vagina is hot and dry. Okay, and then we have the cervix now, is fully dilated, but it's hanging like a curtain. Okay, that is what the notes are saying. Okay, eyeing like a curtain. Okay, then we leave that. Then the membranes have ruptured also. That is another sign. And then there's excessive molding and excessive molding, and then we have also which might occur with large caput or caput succedaneum. And then we have the other thing is that the fetal head is high, not engaged. Yeah, I think those are the signs we can find in obstructed labor. The question was asking for signs, and I've given a lot of signs. Then the other thing was saying, and then you describe the nursing care with woman with obstructed labor. So as a nurse, what would you do? Okay, I'm just giving this a revision. I don't know. Yeah, the revision. Okay, let me give what I found. Okay, the first thing is that the woman is shocked. Oh, I'm gonna lose the child. No, what? Maybe that is what happen. So, first of all, the nurse give a calming reassurance to the woman and encourage her to progress with the labor and give her emotional support, because that time, those time when pushing, I know I've seen even people on social and celebrities crying. Yeah, so the labor is painful. I don't know, but I've never experienced it. But the way you're watching videos online, you can see it's painful. Oh, mothers, they're going through pain. And so in obstetric labor is a lot of pain, because the baby is trying to come out, but it can't come out because of some obstruction somewhere. Can you imagine the pain of the baby suddenly trying to get out, but it can't? You understand what I'm saying? So so first of all, you give a calming reassurance and emotional support, and encourage the woman to continue, like to progress. While you just get a lot that the child is gonna be okay. Anything at the same time, when you're encouraging the woman, please monitor the fetal heart sounds and in this time we use what we call the electric fetal monitoring, especially if the fetal heart rate are non-reassuring or suspicious. Just you monitor the fetal heart rate and make sure that normal. And we say the normal fetal heart rate is 120 to 160, 110 to 160 beats per minute. Then also monitor maternal vitals. Remember, one of the things we said, there's tachycardia, there's exhaustion and scanty urine, so you have to monitor the the mother's vitals and the urine output. At the same time, in this obstetric labor, please don't tell the woman to sit down or to cry. No, we're saying encouraging them, but also telling them to encouraging them to ambulate, to kutembea hivi, and also encourage them to change position. Encourage them to sit to be in this position that we call all fours. Also, you can in a lying positions. We can we call it exaggerated Sims position also, which is also exaggerated Sims position, yeah, where the woman now lies. I think I'm still going to explain it. Like it's the Sims position. You like you are. It's we call it semi-prone position. Yeah, yeah, it's correct. Semi-prone position, where your one leg is raised. Yeah, you know what I'm saying. If you're a nurse, okay. What else? What is another point? So the reason why encouraging the woman now to change position is because we want it can help to ease the back pain also, and also it can help change the fetal position. So if the fetal head was stuck into the parietal menisces was stuck in the obstetrical conjugate, and when you do those changing of position, the all falls, yeah, the falls is good. When you do this change of position, it can try to release the impacted head, and also helping the delivery faster. And then also in second stage of labor, you encourage the woman like to squat, yeah, an upright position. Also, the other point is that we provide the woman with comfort measures, such as you help the woman to like with teach the woman breathing techniques, or the relaxing techniques, such as you're telling a woman to take a deep breath, breathe in without just tell her to breathe, yeah, and also give aromatherapy or some hydrotherapy. Aromatherapy sana sana hao watu wanajipoa kwa nini kama bathtub hivi, tap, yeah, aromatherapy. What else? Also, you can there's this nerve stimulation tense, yeah, we call it transcutaneous electric nerve stimulation, which helps to release the hormones such as endorphins and enkephalins, so that you can able to help in pain relief. Yeah, I think that's all the point I had to share. Yeah, that's all. Okay, the last point nimeona sasa ni please don't forget also to give IV, initiate IV access and administer IV fluids to maintain hydration, because you want to prevent what we call ketoacidosis. I think I mentioned that, to prevent ketoacidosis and also prevent shock. Then we have, if now you have tried changing of position and all that, you can try what we call the assistive bathing techniques, such as forceps and vacuum, like if that is possible. But it's not possible, the last resort then can be conduction of CS. So that's all about the question that I had about obstetrical, about obstructed labor. So the question was asking, let me quote it as I finish. It was asking 4 signs of obstructed labor and describing the nursing care with a woman with obstructed labor. So that question was 10 marks. So I think I've explained everything there, and now you can write your point and you can pass your exams. So bye.